the Javelin Bladder 100 study definitely fills an unmet need in the portfolio and management of patients with advanced urothelial cancer. This was a uniquely designed trial for patients who had received cisplatin plus gemcitabine or carboplatin plus gemcitabine and had a CR, PR, or stable disease with that standard first-line therapy. So patients who had primary PD to cisgem or carbogem were excluded, and so that part of the trial, that piece of the trial was sort of that aspect was not part of the trial. You sort of came into the trial already having received your treatment and had received up to 4 to 6 cycles of first-line therapy. The trial sample size was 700 patients. Patients were randomized to best supportive care or maintenance of avelumab that was given until progressive disease, unacceptable toxicity, or withdrawal. The primary endpoint for the study was overall survival. The study enrolled about 50% of patients or so who had PD-L1 positive disease. It was predominantly lower tract, about 3/4 of patients were lower tract. And with regards to their response to primary treatment, around 70% of patients actually had a PR or CR to primary platinum-based therapy. This was a positive study. It is a practice-changing study. The combination of avelumab plus best supportive care resulted in improved overall survival compared to best supportive care. So the median OS was 21 months for avelumab, and it was 14 months for best supportive care. And really, we haven't, in the field of bladder cancer, urothelial cancer, we have not seen numbers this good since platinum. And I think the fact that we had a plenary at ASCO, it's actually the first bladder cancer, urothelial cancer plenary at ASCO, I mean, speaks to just the magnitude of effect here. So, the benefit in overall survival was seen across all subsets of patients by age, performance status, frontline regimen that was used, by PD-L1 status, creatinine clearance, slice of meds. So all subgroups benefited from the use of avelumab. And then, thinking about does PD-L1 positive, does PD-L1 disease matter? Does it matter if you're PD-L1 positive or not? In bladder cancer, unlike other malignancies such as kidney cancer, PD-L1 positivity seems to be prognostic of actually improved outcomes as opposed to worse outcomes. We saw that when we look at the control arm of both of these trials. But whether you were PD-L1 positive or not, it didn't really matter. So the take-home message, this is practice changing. And it's interesting, there's no other trial that's really designed like this with maintenance therapy. It definitely, I think, calls into question what we do in the frontline space. And again, I think platinum remains king for patients with, especially cisplatin for patients with advanced urothelial cancer. So exciting to see this data.